Hi, good afternoon, everybody. Thanks to the people that have registered for this month's session, the discretionary spend focused session. There's over 100 people registered, so thanks a lot. I really appreciate that. This session today is, as always, going to be about systemic reform and how can we optimize productivity and improving well-being for staff and such like. I'm really privileged today to have Andy Wilkins with me. His role today is going to be to really challenge me and drill deep with a lot of questions. I want to do less sort of presentation work. I just want to set the scene with some presentation work to get us all in the right frame of mind. And then I want Andy and the audience to really drill me with a lot of questions to pull out all the work that I'm working on so that it's useful, that I can hand over this learning that I'm going through to the audience. So thanks again for signing up and registering. If you're not live, then hopefully you'll enjoy the recording of this as well. So I'm just going to start by saying, if you have registered, it sounds a bit of a dull topic. You've probably had some experience with bureaucracy pain, which a lot of people associate with these discretionary spend regimens. So I really want to drill into that and unpick it. And my ambition is to turn that bureaucratic nightmare into a proactive, productive, really useful exercise. The other extra thing I'd want to drill into, and Andy can pull me up on this if I do fall down this trap, as I don't want to come across as being negative and try and slag people off. Essentially, that is not what I'm trying to do. These are universal problems that we're all affected by, so I don't want to go down the blame game. So if I do sound like I'm going down that route, Andy, please pick me up on it.
I certainly will.
Excellent. So do you want to just do a quick 60-second intro of you, Andy, as to why you're so relevant and useful and being part of this panel for me?
Thanks very much, Anthony. Yes, as Anthony said, my name's Andy Wilkins. I run a sort of think and do tank called Future of Health, which kind of does what it says on the tin, which is look at the big trends happening in health and care and to extrapolate those forwards, thinking about new medicines, new technologies, new ways of doing things, to see what kind of future we could aspire to collectively build and how we might begin that journey. So it's looking a little bit further ahead than the next year or the next 3 years, next 5 years. In fact, I mean, looking at the next 10 years, next 15 years. And that work has led me to have some opportunities to not just think about that theoretically, but practically bring that kind of thinking into action. Like, how do we build a better future rather than how we squeeze more juice out of what we've got? And I've been fortunate enough to work very closely with Suffolk and North East Essex ICS, bringing all the partners together, using a 3 horizons approach to imagine a shared future and how we get there and what all the changes and different ways of doing things might look like. And I'm just kicking off a piece of work with a trust to work with their team, also executive team, on how do we reimagine a hospital trust in this new 10-year NHS plan world, and what different ways of working and collaborating and use of technology that might bring. So all of what you're talking about, Anthony, is super relevant to the work that I'm being involved in and will continue to be involved in. So I'm delighted to be here with you today.
Yeah, fantastic. And for the audience, it's really important that I've got somebody like Andy with that background and that critical thinking to drill deep into this whole project, if you like, so that we can get more value out of it. Okay, so I'll just do a few bits of slides just to get the momentum going, get the context set. So first of all, I'd just say, re-emphasize, please, anybody that is live in LinkedIn now, do collaborate with us. So go into the LinkedIn comments to either share questions that you've got as I'm talking through things. Questions pop up, please do share them. Make them as challenging as you want to. Also put your experiences in as well. So we're on discretionary spend today. You've got any specific examples about your experiences, add them in. It brings the whole process to life. And do participate either with questions or your experiences. More collaboration makes this whole process work more effectively. Okay, so next slide is just to reiterate that we've got a brilliant use case to bring this to life today with specific examples. But these generic themes apply everywhere. They are really universal themes. And I'll keep coming back to these, and the future live events that I do as well will be all linked to these things. So we've got some real principles, and I know Andy works to these as well. But where we always come unstuck and we always have problems with productivity and well-being for staff is, I believe, first principle is a focus on flow. So if we can really focus on breaking down our silos that we all work within and focus on the flow of the complete process to serve the customer or serve the patient from right at the start to right at the end, things change radically. So rather than us focusing on our own little world and our own set of KPIs, we have much more open mind around how can I facilitate and serve the person that's next in the flow, giving them the right information in the right format and really thinking these things through. That's a real fundamental that at the moment we fall into a lot of problems with, and we'll showcase these in reality with this specific example on discretionary spend. The next one is people-centered approach. Again, just mentioned the breaking down the silos, but understanding the impact of the entire system and how it flows and unintended consequences and those sorts of things. And the third one is management information. Whether we are a consultant that's trying to go through a massive amount of information on a patient's stats and background, etc., and condition, or whether we're a user going through a discretionary spend process, there's typically universally a lot of information and a lot of guidelines and a lot of reports and a lot of study needs to go into us making the right decisions and getting those things right first time. And I believe that AI is integral in supporting this flow, predominantly through how do we, in a live environment, very bespoke context environment, say that's the set of rules, that's the set of information you need in order to make this decision. So you don't need to go away and read a 50-page guidance document. The AI can give you the relevant information to make the right decisions at the right time, right first time, right there and then. And then the second element of this is how, when we're in the process and we've submitted what we think our work is and our decision is, how can AI support an evaluation and a critique of that, so that again we're really assured that that is right first time. And we'll come to the examples of this in this discretionary spend process. And then how can we use AI to support that whole flow design, which is exactly what I'm doing now with this discretionary spend work. So these are generic themes that come up again and again, and today's use case will explain these in more detail. So I don't know, just before I get into some detail of discretionary spend, Andy, whether that makes sense, whether you want to just question me at all on this before we get into the specifics of discretionary spend.
No, thanks very much, Anthony. No, I think it's really important, these themes that you've highlighted. The work that I've done, I'm sure many of us have been embedded in, sees how siloed our activities have been for all sorts of legacy reasons. And one of the things that arises out of being in silos is that you have measures of performance based on what happens in the silo.
Yeah.
And we're always trying to optimize and squeeze more juice. But if we take a step back, we often see the siloed ways of doing things at a meta level is not the most effective systemic way of doing what we're all collectively here to do.
Absolutely.
How do you think we better bring that to life? Because if people are focusing on what's happening in their silo rather than seeing the bigger story and the flow through it, how do we bring that to life for people?
Well, I think that's an absolutely brilliant question. And I think almost all that we do at almost every level as it is at this academic level. So people like me and you and the 10-year plan really talk at this level, and it's all academic. And we can get it intellectually, but it's not until you physically start working through this stuff and it's a participatory knowledge, not just an academic knowledge set, that it comes to life. So that's a great sort of segue into us getting into the detail of discretionary spend, because we'll be able to practically see examples of where these problems are and how they play out. And when you've got tangible, visible elements that you can relate to, it starts to come to life. So I'm hoping that this entire session does just that.
Yeah, and And just building on that from the work I've done on patient experience and other things, which just is looking at the experience at the sort of top level of the flow, where it touches real people as opposed to all the underlying flows that exist within the system. For the work I've done, it's really shown how each part of the system does its bit and thinks it's doing a good thing for patients. But when you follow patients through the journey, the disconnection, the loss, the confusion of what happens next and why am I going here and why I've been asked to do that, and hold a minute, that conflicts with, there isn't that sort of joined up flow. So coming to your people-centered thing, there's often a rationale with what does the system see as flow that suits the system, as opposed to the flow that suits the people we're here to serve, which may ask and invite a different kind of flow. And that this is really important to sort of distill out. So we're not just making the system more efficient for the benefit of the system, that's anchored in a flow that makes sense for the patients we serve and the people who operate within it for their work.
Yes, exactly. You've really hitting the nail on the head. And I think it's not just respecting the patient or the customer. It's also respecting the other colleagues in your organization in terms of the next flow. So a little tangible example, again, I don't want to be seen to be criticizing particular people, but I'll just throw some examples out. So in discretionary spend, it's a dictate often from NHS England that this trust isn't performing as it should, therefore you have to implement this discretionary spend process. So certain trusts, any spend at all over 1p needs to go through a process. So that's a dictate from up above, and there's a certain set of data collection criteria required. So then you can sort of naturally see that IT people will go, well, we've got to collect that data that's been dictated. So therefore, we'll just create a big long form to collect all this data.
Yes.
They're busy, they've got to get stuff done, so they'll just bang this form together.
Yeah, and maybe a good bridge into the discretionary spend is Esther Griffiths has popped a question which is linked to maybe siloed transactional ways that we work at the moment, that often is then linked or hardwired into the procurement process.
Yes.
So we're making procurement determinations and setting up contracts and setting up relationships to do bits of flow rather than having an understanding of the flow that can more wisely inform what those contractual relationships with suppliers might be. And therefore there's a role for procurement also to understand the flow we're aspiring to, so we don't reinforce the non-flow through narrowly conceived procurement arrangements and contractual
So I'll just quickly overview that as well. So we've got, at the moment, we might have IT teams that are banging stuff together in order for them to hit their targets of NHS England need this. That, if not thought through properly, you end up collecting, I don't know, 50 data fields, because on the face of it, that's what's been told. But actually, if you do some proper design thinking and link these things together from a user experience, we can maybe get away with 20% of those fields being collected for this new initiative, because we've already got a whole bunch of these other fields already collected. We already know about them. You know, those 5 fields, if we use the system smartly, intelligently, we can unpick the other 2 from the first 3. You know, it's that level of detail can take an experience as a user from an absolute nightmare to actually that's really quite manageable. Yes. But you need a lot of thought and a lot of energy going into the design of that, and that's where the people-centric thing comes in, as opposed to I'm just doing what my silo demands of me. You're thinking about other people in the flow, optimizing the whole thing for the whole system. And then another quick one is we've currently typically got separate systems and silos for waiver forms. We've got separate systems for procurement. We've got a bunch of separate systems. So all the user feels at the moment is it's bureaucracy duplication. So I'm filling this form in here, and then I've got to fill this form in here, and then I've got to fill this form in here, and there's massive duplication between all these different systems, and we've ultimately got to join them up. So from a user perspective, it's a one-stop shop, and it's not fields, it's 20 fields. That sort of thing, absolutely.
And then I just a further final point, just to sort of augment Esther's point and take it one stage further, is that if we have a desire to build a more systemic approach that incorporates better flow, and that's a journey to build that, then there's an invitation potentially for suppliers to be invited to help co-create this. So rather than having fixed contracts that tie people down to what they do, there's an invitation to the broader ecosystem of suppliers to contribute to the co-creation of that future. So it's really inviting more systemic approach that extends beyond the boundaries of what we've normally thought of NHS institutions to include other actors who have something to contribute to this story.
Yeah, you're really getting to grips with this now, and we're going on to phase 2 here very quickly. Excellent. Okay, I will just whiz on to the main slides then. If you can keep an eye on the chat and jump in, Andy, if anything really critical comes up. I don't want to spend too much time on these next set of slides. I just want to set the context for everybody so we can get the flow of questions going.
Brilliant.
So what I did at the start of it, I'm working with a trust that's looking into this problem. So I'm not going to name the trust. That wouldn't be appropriate. But just to say that I've got some deeper experience, some personal experience of this whole topic. But this is my first step that I did, which was some generic deep research, a knowledge management type work. So this is international, predominantly NHS, that's driven the data for these slides. So there's the overview of this process is, I guess, just for people that have signed in or are watching this that don't know the detailed background behind the discretionary spend. I mentioned earlier, NHS England will typically say you need to implement these processes. There could but well be some trusts that are implementing similar type processes and systems just because they want to be best practice in terms of value for money and governance. But I think typically it's an NHS sort of dictate. So then trusts go away, and they will. I think in a lot of cases it becomes an industry in itself of setting these processes up. So how do you capture every bit of spend that's going through the system? You typically need some IT system to capture the requests, and then they'll go through to some sort of panel structure where different panels will review what the requests have been and then sign them off, reject them, or query them. And typically that process is taking, on average, of the work that I've done, it probably takes 2 weeks, even for a simple one. So for something that, a £50 order for pens, papers, and staples could well take 2 weeks to process. That's the average time. Others can take, the longest I've seen is 91 days for it to get to a resolution point, and that resolution point could be rejection. But the amount of people involved in the whole process, in terms of the users putting the data in, admin managing the whole thing and setting up the panels, panel days, very senior people in senior positions doing all those sign-offs, it's an industry. And when you look at the cost associated with that industry, it's very, very costly. So that's sort of the background to the whole general topic. And then these are some of the findings from the international, but largely NHS research. And a lot of this is academic research driven. So these are some of the headlines from that deep research paper that I've pulled together. So savings are trivial. So the spend associated with some of these trusts is really, really high. So we're talking multi-million pounds every month in some trusts. And some of the savings that are coming through as a result of this new industry being created in the scale of things are really quite small. And most of the actual requests that go through get approved anyway. So it starts to raise all sorts of interesting questions around, well, if everything's getting signed off anyway, what is the point of this whole industry? To be debated. I don't know if we've got any more feedback points coming through. So that's an important issue for us to think in the design of these things. And another thing is, a lot of the requests that go through are already contractually committed, so you have to spend them anyway. So the panel might say, we don't want to approve this, but actually, if you then don't go through and approve it, then there's a contractual risk with those contracts already in place, which is a risk to the organisation, the credibility of the organisation, etc. So again, we need to manage that in terms of the system and the flow, reduce those that are going through to panels that shouldn't go through to panels, but we still want the whole ethos of how can we improve value for money. So we don't want to disregard those completely. I still want, in my vision of the new world, we still want the AI to nudge users to say, okay, this is contractually committed, so you will be able to process this, but what is your experience of the quality of this service? So even though at this point in time we're committed, contractually committed, feedback from users could still be massively valuable for the commercial teams and for procurement teams to go, look at all these signals we've got from this particular supplier. It's really not performing well. Let's renegotiate that contract. So all this comes into play in terms of really, really good design. But this is the, if you like, the findings from the generic, this is what's happening generally. So the savings are trivial. The costs aren't actually displaced because they go through anyway. They're very small in proportion to the total spend that's going through. And there can be false economies as well. So for example, if we start cutting our expenditure on maintenance, that will come back to bite us in the next year or two. You know, instead of us spending 5,000 on maintaining something, we've got to spend 50,000 on replacing it. So these are the sort of the key themes. Next one, this is a bit small for everybody, sorry, I'll just read through the headlines. Delays. So you could imagine being a nurse on a ward or anybody really that needs something that's really low cost but could be really critical in terms of their ability to do their job and to serve patients or to serve the next person in the flow of the system. If it's urgent and it's really low cost, and let's say it costs £20, I think there's an example in there, in this example here, you want that to be signed off within 24 hours. You do not want to be waiting 2 weeks for that sign off. The unintended consequences of the delays can be really, really serious. I don't know if it's the next slide, but there's an example of second-class stamps, where if we go, I think it might have been on the previous slide, high-level panel decision is, okay, let's save 50% on postage costs by going from a first-class to a second-class stamp. On the face of it, that's going to save us, I don't know, £100,000 a year. But actually, if the impact of that means that we are increasing DNAs by 20% because all these letters are not going through in a timely way, such that the appointments are getting missed before the letters even arrive, the costs of that are massively more than what we think we're saving. So things like that come through. The next area, and I think this is a huge one, and it's easy to underestimate or ignore, is the impact culturally on our staff. So this, you must validate and explain every penny you spend, essentially gives a strong message to staff that we don't trust you. We have to look over your shoulder at everything you do. And I think in an environment where people are already stretched and overwhelmed, that can in some cases just be the straw that breaks the camel's back. It's just too much. It's like, I didn't come to work for the public sector and the NHS to do this sort of work. I came to save lives and to, you know, help people. And yet what you're doing is making me justify every 2 pence that we spend. And I'm being a bit dramatic, but just to make the point, I definitely feel that this is a real sense of emotional feeling in the workforce. A feeling of, this is taking me away from the job I'm meant to be doing. And yeah, back to this goodwill's just exhausted. Jump in if there's anything really particular you want to focus on, Andy. And then that takes us into the recommended solutions. They're the generic, you know, evidence base from many examples of this sort of initiative. So it probably is a good place just to have a quick chat before we get into some of the solutions.
No, thanks very much, Anthony. And it seems a lot of what you're talking about is sort of sits in a meta model I'm seeing. I'd be interested in whether others are seeing this as well. Is that historically we've, for all sorts of historical reasons, I guess, we've built our health system around a kind of industrial model, it's like a machine, a factory of care, where we pop people at the front end and process them through the sausage machine and spit them out the other end. And of course, we're getting greater and greater demand, and the machine is having to work. So we have to squeeze more juice out of it. So a lot of the things that you're talking about, where is cost happening in the machine, and how do we clamp down on this bit and clamp is a sort of tightening of the machine to try and manage a process where machine thinking isn't the right thinking. When you surface things like flow and person-centered, it's inviting us to think of our organizations as, to borrow from nature, more like an organism that can sense and respond, and we're all working together as an organism rather than working as a bunch of machine parts. And it can be quite soul destroying, finding yourself in a system that's sort of tightening down to make you be a more efficient cog in a machine, where we're actually being invited, if we take a step back and look at these whole flows and person-centered, inviting us to have a different frame, a different way of working, where we're more sort of working as one organism that's sensing and adapting and responding to the change in demand that we see out there and the new technologies arising.
Yeah, really insightful. And I think the irony is this tightening, if you like, of the screw, it becomes more dysfunctional because it generates more waste and more rework.
Yes. Yeah, so from the work I'm doing in the hospital trust at the moment, we've done some workshops with clinicians in urgent emergency care and planned care and in neighborhoods. And one of the things that's coming out, to echo your point, is the amount of failure demand inside the system, that people are tightening the screw and shortening the amount of time with patients, or reducing the amount of collaboration and relationship working because no one's got time for that. And then things are moving through the system that shouldn't be in the system anymore, or people are representing because not enough time has been spent to educate them on what they need to do. And so the machine, as you tighten the screw, as you wisely say, creates more work, which then overwhelms the system that wants to tighten it again. So you kind of end up in a sort of death spiral.
Yeah, you do, absolutely. So in the context of discretionary spend, there's a new process installed and stipulated, so naturally staff go, oh my god, not another one, and it's a duplicate of all the other systems that they've got to do, so it's another form, and there's another 50-page guide and set of stipulations that they've got to know and understand. So it doesn't feel like this is a progressive, helpful process to serve what we're here to do. It feels like another screw turn. And then they haven't got time to read the 50-page document on the guidelines. So they'll go into this new form, which has been designed with the 50 fields instead of the 20. And it's hard to navigate. And they'll tend to go, the bare minimum information just to get through it. So they won't explain properly what this is. It will then go through to the panel, and the panel, this is where the dysfunction and the rework comes in, and the failure demand comes in. The panel naturally go, well, there's not enough information here for me to understand what this is, so I can't approve this. So it goes back, and then the panel don't give enough information on why they've sent it back. So there's multiple dysfunctions because none of it's getting done right first time, because everybody's busy in their own little silo. So the panel members are ridiculously busy. They've got full-time jobs. The panel is an additional screw turn on them. So it's all the way through this sort of pattern. These generic themes, these universal themes are coming through. Okay, so next slide. So a strategic shift. So this is the analysis of the deep research from the web for all sorts of trusts that have been engaging with this, and the academic study recommendations. So there's not really as much focus on AI with this set of recommendations that I am working on. But again, it's just a really interesting start point. I think we would agree with this, which is we've got a shift from a top-down command to an empowerment and trust. So from my mind, we need to empower our staff, because that is the great asset that we've got, is the staff in the NHS in particular. my God, so brilliantly aware and intelligent, that every brain is like a supercomputer that I believe we have to tap into to optimize the system. So if we can turn it from a top down, you must do this, and that feels like I'm adding no value, this is not what I'm here for, this is all useless, into a how can we work together to optimize the value of the hospital and of the system so that we can better serve patients. That's the paradigm shift that I'm looking for with this system. So I definitely agree with that. I just get your view on that before we move on to the next one, Andy.
No, I think that's very, very important. One of the ways I've been looking at this, which I think you're speaking to here, is taking a step back from the system of rules that we've created to say, given where our piece in this whole system, how do we create value for the people that we serve? What matters to them? And let's take a step back and really kind of map that out and look at what does good look, not good in terms of how we stitch all the things together at the moment, but what are we here for? Have we truly understood that? What are the dimensions of that? Then go back and look at the system that we've created, and what we'll see, there's probably a huge gap between how it's evolved over time through the silos and the processes. And then start to question, how do we bridge the gap between how things are and how they could be? And this is where people at the front line who see what works and what's not working have valuable contributions to make. And it's an invitation to step out of the silos, to come together and look at what could good look like, and how might we begin the process of making that possible, such that what then flows through creates the value we were originally here to serve, but in a way that works much better for the people that we serve and those involved in providing it, because we've done that work to pull together. Now, you can't see that from the top. That level of unpacking and understanding and reconstituting can only be done by people who are close enough to see what that actually requires. So I agree with you. I think distributing decision-making and empowerment closer to where these problems are burning red hot will be the most effective way to try and solve them.
Yeah. And just to give a tangible example on this one, in terms of changing that flavor and that lens and that focus, is let's utilize the intelligence of AI to say, as an example, as you're putting in, I need to order paper, for the AI system to support you by saying, do we really need 400 milligram? I'm just making this up because I have no idea about paper, but do we really need 400 milligram paper for this? Or could we get away with 200 milligram paper? Because there's a 30% saving there straight away. And the user might at that point go, you know what? I think for this purpose, yeah, that would be fine. Actually, 200 milligram paper would be fine. This is just draft paper that we need around the office to communicate. I'm just making this up, but that proactive flow and prompt around can we do things better is really useful for the user. It's helping them, break down all the relevant information and turn that into the useful, right, optimal decisions in that live scenario. So it's no longer a screw, just go through that, just try and get through the day. It's I am actually making a positive contribution towards this hospital making these savings, which we all need to do. So it's a real change, but it's something we can do, and we can tie all these things together. And AI for me is a really brilliant facilitator to enable that optimization.
So John Paul's put a couple of good questions or comments in there. He's made the point that, and I think you've touched on this already, Anthony, that the spend management process itself is maladaptive. It doesn't learn and know how to improve and get better. It's just trapped in its own screw tightening logic. How do we break out of that? But then he's also made the point, as we've just been talking there, about maybe empowering decision making to help build the flows in the person-centered way, that invites letting go somewhat. And John Paul makes the point that one of the biggest worries of leaders is if they simplify and make the process of discretionary spend easier, they will lose cost control in their organization and budget. So how do we address the fear of letting go allowing people to start making wise decisions rather than trying to micromanage through process and rules?
Yeah, great question. This is the sort of thing that I really want to get into. I would double down by saying, and I'm spending hundreds of hours on this topic in the design of this as well. I would double down and say the opposite is at play. If we do this right, it's not letting go of control. It's actually getting loads more control, because, and at the same time, creating a positive, vibrant, proactive environment for the workforce in taking part in this, to the degree where users are thinking more about what it is they're purchasing and why it is they're purchasing this and what the alternatives could be. So the data in is massively better, massively more thought through. AI systems can validate that and reconcile that and do some research to say that is a brilliant case that user's made, and scrutinize it, a bit like you're scrutinizing me now with these questions, forcing me to think this stuff through. And you'll get to a point where you go, I'm confident that Anthony's making sense there because he's providing the evidence in order for me to get that sense that this is a good case. The same can be true with the AI. And then the AI can then produce very well written PDF summaries of the business case with the backup, quotes, etc., whatever it might be, doctor's notes, to validate that request, such that every panel member has great summary information about what it is. The AI can even give it a score based on criteria that we set to say this is a very well evident case. It's below the certain thresholds. It only needs to go to this panel. It can be massively more controlled and value add. So I think the opposite is the case of the traditional, we'll lose control if we don't do it this way. I think we can get a lot more control and save a fortune. I think we can reduce 80% of that bureaucratic industry through setting these systems up right in the first place and massively improving the analysis and the decisions on the back of it as well.
Yeah, two things spring to mind there. I think you're absolutely right. Rather than trying to micromanage that from the center and everyone being over bureaucratized to the point of scleroticism and all the sort of consequence of that, which you've described in your presentation, there is something about how do we establish value from doing things differently that isn't that micromanaged way. And this is where AI can come in as a tool to help model things and evaluate suggestions and indicate there may be a better way of dealing with different types of things so that they don't all end up in the sausage machine clogging up the system. And I think you've rightly articulated that. But there's also the human story as well. One of the things I do as a sort of side hustle is chair customer experience conferences, and you're listening to how the private sector are dealing with this challenge. And a lot of contact centers have now moved to, rather than giving people fixed scripts and things to follow through, to giving people at the front line discretionary spend of like, here's £100 that you yourself can use as a way of issuing a refund or contributing to something that goes wrong. And the initial fear was, we'd lose control, and this is, the CFO was really unhappy about it. But what it effectively did was say to the staff at the front of line, we trust you to make wise decisions on behalf of the company and behalf of customers that you're serving in this case. And people, instead of managing a process, inviting to use their autonomy and agency to make decisions, was a sense of empowerment themselves. And it changed the nature of what it felt like to be employed, because the organization was trusting you, and people largely stepped into that role and became better and more committed to the organization by that respect that was given to them and that trust. So there's human benefits as well that comes from delegating that authority. Yeah,
absolutely. I mean, just the difference between somebody going to work hating it and going to work feeling empowered and passionate about their job. Wow, the difference in productivity is insane. And I think this ties into exactly that point as well. Okay, I'll whiz through the next couple of slides, just so this will draw out for us these questions. So this one, just recognizing the difference between the system needs to be smart enough to recognize that we don't deal with a already contractually committed spend that's low value having to go through the same level of scrutiny as something that's £50,000. So I think this, the system and the design needs to be smart enough to route different requests in different ways. But I would say that doesn't just discard some of these requests. I mentioned this earlier. Something that's already contractually committed, I would still want to capture from the users. Are we getting good service from this? That creates great signals to the commercial and the finance and the procurement teams around, we need to renegotiate these things with our external partners because we're not getting a good service. The quality is not good enough. So I think we can create a one-stop shop system that does everything in one go. So we're not duplicating from a user perspective. I've got to do this form for waivers. I've got to do this form for discretionary spend. I've got to do this form for procurement. One-stop shop. We provide everything that we need to provide in one place, really easy to do, including that feedback on how performance is of these existing resources or services. It becomes completely different. The user experience is brilliant. The data we're collecting for the other teams in terms of long-term contract management is really powerful. So I think we can do these workaround. We can recreate and redesign these systems such that the flow does everything in one go, and we differentiate between the different things and reprioritize and capture different amounts of data for different things. I'm waffling, but I'm sure you get the feel.
Mm.
So that's that one. Let's just check the next one. So we are talking about technology here to help automate and streamline. Yeah, and this is largely what I was just talking about there about the front door. So there's one place to do everything. Design it so that we can get everything right first time. And for me, AI takes this one step further and enables us to provide the right knowledge and guidelines in a timely way, in a simple way, so the users make the right decisions at that live moment. That's huge for me. It ties back to my work on National Menopause Programme. That's essentially what we did, was created information for primary care to access really quickly, which was much more user-friendly, much more detailed than nice guidelines. That sort of work can be really, really change a lot of impact on those GPs or primary care clinicians. Same thing with this. AI can be a massive help with that. And then AI talking you through that process to go, actually, that first submission you've made there about what you're doing and what you need this for and what the implications if we don't buy it isn't strong enough. We sort of know from panel experience that isn't going to get passed. You need to give us more information, more evidence. AI is fantastic at that. It ensures that we get the right information in right first time to avoid all that failure demand down the line, because the panel can then get that information and go, great, I know exactly what this is. I know exactly what they're trying to do. The AI has validated that this is good value for money compared to other cases out there. I can sign that off. Or equally, it's a really well written report and the AI score is low because the AI doesn't believe that the evidence is strong. The price doesn't validate from web research, and therefore the panel can go, we don't believe this is good value for money. We're not passing this through. So AI can be so helpful in these critical sections of the flow to help us generate the right first time culture. And then the third element is AI can really help us design that flow and this system from soup to nuts and think through all the unintended consequences. So if we do this, what are the consequences? And you think that through in real detail at this stage, design the system in the right way, and everything works, and we've got a brilliant flow. And then I think the last slide is just that cultural shift, which is what we were talking about at the start, really. Let's move away from silos. Let's think about the entire flow. move away from blunt controls, really think these things through and the consequences all the way down the entire flow. As a result, we will reduce failure demand, we will reduce bureaucracy massively. And I think my ideal vision for this redesign is we don't have weekly panels. We move it to a 24-hour turnaround, and the panel members don't have to schedule out half a day or a day a week on these big humongous panels. We can manage it such that they can manage their element of the review at any point of their day, and they'll have set days that they're responsible to review on. So instead of you booking out your half a day or a whole day on a Friday, your set days to review things are Tuesday and Thursday, and you can just pop into your unique screen to sign off your unique elements anytime through Thursday and anytime through Tuesday. So the work for you is massively more beneficial and flexible for you. And my goal is, instead of you spending half a day on a Friday, you end up spending half an hour on a Tuesday and half an hour on a Thursday. So I want to more than halve your panel time, make it much more flexible for you as a sign-off reviewer, and take it from a 2-week turnaround process to a 1-day turnaround process. So the users getting massive advantages through knowing exactly when the sign-off is going to be. It will be within 24 hours, unless something untoward happens. As a standard, it will be 1 day. The work that I've been doing so far, the standard deviation is massive. So it could be approved in 1 day, or it could be approved in 91 days. And the users just really are struggling to know what it's likely to be, which creates all sorts of other dysfunctions. So that, I'm waffling on now, but you can get a sense of, you do think this through properly, and you think in terms of human-centered and who needs what, and how can we optimize it for the user? How can we optimize it for the panel member? How can we take that horrible admin job of taking all these requests and sorting them into panels and chasing people up? How can we just take that out completely? Because we don't need to do it, the system can do it. That's where I'm at. That's what I'm working through. So I will just close this down, come back to us.
Fantastic, Anthony. No, that's really insightful. You've shown us multiple layers of the stack, how AI can help us rethink the whole procurement and discretionary spend story. And it strikes me this is also part of a bigger conversation of how do we think about AI and where do we use it. In a simplistic way, and I see this all over the place. So this is kind of the go-to first thing that people tend to use AI. So we've got all these siloed things that we do, and we've got complicated process. Can we use AI on making the legacy thing that we do work faster? Can we squeeze more juice out of it by using AI to make the old model work? And yes, you probably could. But you're pointing to something more fundamental here, which is AI gives us a set of superpowers that enables us to rethink how do we manage this whole area in an AI world? Because it's not just taking the legacy thinking and making it work faster. It's enabling us to rethink from the ground up how we do, in this case, discretionary spend. And so what you've surfaced there is, what does value mean? How do we think about whole flows rather than siloed bits? How do we think about, instead of looking at things in parts, see them as wholes? And if the whole can be made better, and it invites the parts to reassess themselves or rethink, or even remove some of the parts and replace them with something better, that's the level of thinking that AI enables us to track and understand and model. And if we can also use AI to help inform and coach and give greater awareness and understanding of how to do things, what value means, and how processes work, then instead of being impaled on the system is starting to serve and inform and create learning within the system itself about how we can get better and wiser in the way that we make decisions. And by passing them in the way that you've said, some of them don't need the full human involvement. Some of them can be, there is probably, by segmenting the types of things more wisely, the stuff that can be automated and distributed to the front line, the stuff that maybe does have consequences that need other actors involved, but we could take a lot of the overhead out of the system and position the decision making at the right level of the stack, if you like.
Yeah.
And this thing about consequences, I think, is super important as well. A lot of process has embedded in it the fear of stuff, risk that what if someone made the wrong decision, we need to put something in to prevent, and that clogs up these processes. But risk and reward are two sides of the same coin, because if we get too risk averse, we prevent things from happening.
Yeah.
So how do we understand consequences and risk more wisely? And I think AI can help us with that, so we can evaluate and make decisions not on what if something went wrong, but are these things even going wrong, or what's the level of risk here? Can we use that to more wisely distribute the decision making to the best point, probably nearer the front line? And all of that points to faster, more systemic, person-centered ways of working. One thing that John Paul's added in is, and it's really built on this kind of system learning thing. How he's asked the question: how can we create a system that enables people to optimize their own learning, so that staff insights and learning that can help them improve, not just be top down, but maybe horizontal learning from other teams doing stuff, and then finding that, if they're distributed decision making allows them to evolve new ways of doing things, how would the system become aware that something great is happening over here that could be repurposed into another area as kind of an extension of the system learning?
Yeah, brilliant. I've just made a note to come back to that. Just to pick up on your point around AI being seen as at a deeper level, I couldn't agree anymore at all. And that's why I was trying to raise at the start these generic themes. And for me, anytime anybody mentions AI, we should all be thinking not about AI and ChatGPT and answering a quick question or writing an email for me or summarizing a transcript for me. As you say, that can support and make us a bit faster at the standard stuff that we already do. But actually, what AI should be doing is enabling us to think better, have more information to base our analysis on in the first place. So a couple of examples. My last experience with a big evaluation, I've been through several large ones, lots and lots of work, months of work through big evaluations. They typically take months, and they typically cost tens of thousands of pounds. And because of that, a lot of managers will naturally go, we haven't got the budget for that, we haven't got the time for that, so it's not done. So decisions get made on what managers think the problems are without that deep knowledge and deep research that we can glean from stakeholders typically. So that's why I've built Insight Genie, is to glean insight industrial scale really quickly, and 50 times cheaper than the traditional approach. So I think we see AI as a data management tool for us in order to us to make better decisions, because we've got better information on which to make those decisions. We don't have to guess or assume that we know best, because that's full of bias. So the other example would be that report that I shared earlier. Historically, that might have taken me a week of knowledge management research to pull that together. And again, I might have gone, I haven't got a week. I can't do it. I cannot do that piece of work. But now with AI, I can do that, and I can review the document and format the document, and maybe an hour, 2 hours, as opposed to a whole week. That makes me a much richer, much better decision maker, because I've got that knowledge at my fingertips. And then in terms of the how do we manage that understanding of conflict and such like, I mean, I'm using AI to design this system. So, and it's not simple. It's really, really, really complicated. And there's hundreds and hundreds of steps with hundreds and hundreds of dialogues with very sophisticated LLMs, where I'm literally talking through at every step. Right. We are using this back-end infrastructure, Google Cloud, like dozens and dozens of pieces of infrastructure in the back end of Google. Everything's Google, which makes it a bit better, a bit easier. But then it's literally, how does that system engage with that system? And what are the implications if we do that? And it would take me years as an individual to really to map out and understand all those potential conflicts and consequences. So I can turn what would take me months and months into something that takes me days and weeks. It's just a tool to gather information and make you make better decisions right first time.
Yeah.
That's the way I look at it now. But I'm spending at least 30 hours a week doing with AI. So I am in a different place than most people. But that's what I'm trying to get across is, don't think of it as a transcript summarizer. Well, you can, but that's not where the real value is.
No, well, it brings to mind a conversation I had with. Well, I was listening to a professor of bureaucracy, which was, I didn't realize there was such a thing, talking about it, and he was saying most organizations, when they start, they understand the problem they're there for. The people come together, they solve the problem. Then, if they're successful, more people come along, and we have to grow the organization. We have to create departments. So we hire people in who can only see a piece of the problem and a piece of the solution. And as we grow, we have sub-departments and sub-departments. So more and more people get hired in to see a narrower picture of what it is that the organization is there for, like caring for people.
Yeah.
And then we have to manage the work. So we bring in process and we bring in measures of what we accept, what we do, and what we output. And then as more people get hired in, they're actually hired in to manage the process rather than contribute to the value of what we're here for. Yes. And as process and demand starts pushing stuff across the organization, process gets weaponized to manage demand for other parts of the organization. Now we get heat, now we get politics, now we get a sclerotic institution. And his example is that process grows like a fungus inside any bureaucracy. It's a force of nature that will just propagate itself. And that's what we see within NHS contexts. Now, just automating the fungus could be one better using AI, would make things a little better. But what AI does, as you've rightly indicated, it enables us to capture insight and information across vast areas of things that are beyond any silo to see, to start to see the patterning, to start to make new ways of understanding what we're collectively doing, and bring forth new possibilities for working and collaborating in radically different and better ways to serve the public that we're here to serve.
Yeah, absolutely.
In a joined up way. So it's a superpower that needs to have wisdom to know how to use it. But
I think the key is the fundamentals are that flow. So Chris Cooper, expert in this field, would call what you just described waste or dark matter.
Yeah.
So if we can all train ourselves to be super aware of dark matter, and that we're doing that, but that is adding no value to our goal, start to see it, then that's the core. And then AI is the support tool to just accelerate that. Really, that's the way I see it. So I don't see AI as the magic bullet, this will save the world. I just see it as, if we use it intelligently and we work hard with it, we can do amazing things.
And I think Esther's sort of brought to life one aspect of what this future could hold, because often we have one size fits all ways of thinking about procurement. And what Esther's surfaced, that one of the cohorts of people we need to think more deeply about are those who are suffering from disablement, for example, and that processes that enable the system to secure the resources that are needed for disabled people, if they're fitted into a one-size-fits-all process that has exceptions on it, that becomes a very bureaucratic process that can delay everything. But AI potentially allows us to think, well, how would we treat disabled people? Yeah. Is there a way of intelligently managing the demand for them in ways that holistically honor that they're disabled, and that we need to treat those differently? So as we move further into the future, how do we become systemically aware of the different needs of different people or different parts of the organization that could be incorporated into these processes that you're talking about? It's a very exciting future.
It is. And I think essentially goes back to that point of unlocking capacity to do more because we're more knowledgeable more quickly.
Yeah.
Cognitively, we haven't got the space to do everything perfectly all the time. But actually, if that knowledge piece of work, which is essential for the foundation of what we're doing, takes me an hour instead of a week, I've got a huge more cognitive space and time and energy to then look into the, all these other areas where we can add massive value, as opposed to it being a very simple go and do that, which is just not fit. It just doesn't fit. Back to my book, Fit to Care. It doesn't fit with what ultimately we need to do. And then quickly, because we're running out of time, is back to the learning point with John Paul. One of the next challenges and tasks on my list is to design an AI app that supports us in terms of role play almost. So let's pretend that I am going for a job interview. I can put the background details into the app, and then the app can be the HR person and the head of finance that's interviewing me, and they will, as avatars, challenge me and question me in the interview, and I'll respond naturally, and then the AI will evaluate, okay, this is how well you did, this is what you need to improve for the actual interview. These are the responses you're likely to get from the FD. These are the responses you're likely to get from the HR manager. The other angle from a NHS perspective is helping clinicians with very difficult conversations. We can manage the similar sort of thing, so that becomes a really valuable learning tool. So AI can do all these sorts of amazing things, and there'll be hundreds of business cases, use cases. It's just getting our heads into the space of how do we glean that intelligence power and put it to good use. So I think there's loads of potential in terms of JP's point around how can we use it to train ourselves and support ourselves.
Well, Anthony, you've done a fantastic job in the work that you're doing and today as well. AI can be seen as another tool to bolt on to the legacy bureaucratic machine structure. But what you've articulated is, no, this is a superpower that invites us to think about how do we solve some of the problems we're here to solve in a completely different, better, more systemic, person-centered, joined up, flowing way that represents the building blocks of reimagining our health system for the future, with AI as an enabling superpower to help us do that. So thank you very much for everything you've shared.
Well, if that is what's come across, Andy, that's what I've wanted to come across. So thanks a lot. You've massively helped in terms with those questions, and thanks to the guys on LinkedIn as well. Those questions helped us even more. Yeah. So I'll just finish by saying, if I will have the first version of this up and running within a few weeks. All the back-end infrastructure is in place. It's completely 100% safe and secure and encrypted and such like. So if anybody out there is interested in doing some trials and some tests then with me, then please get in touch on LinkedIn and we'll take it from there. Great. Thanks, Andy.
All right,
thanks everyone. See you next month. Bye.